You're also watching the news desk now. Moving on, the World Health Organization has reviewed Africa as the highest rate of people dying by suicide in the world. In a statement, the agency said Africa is home to 6 of the 10 countries with the highest suicide rate globally. The continent is said to have 1 psychiatrist for every 500,000 inhabitants, 100 times less than the World Health Organization recommendation. Around 11 people per 100,000 per year die by suicide in the African region, higher than the global average of 9 per 100,000 people. The World Health Organization says mental health problems account for up to 11,000 of the risk factors associated with suicide. It continued. So what is Ghana's case in terms of people dying from suicide? Kofi J of our health desk joins me live with a breakdown. Kofi, thanks. How is Ghana's case looking like? Kofi, kindly unmute so we can follow what you're telling us. Let us understand how Ghana's case is looking like in terms of people dying by suicide and people who are suffering from mental disorders.
Chris, can you hear me now?
Yes, clearly now.
So I was saying that the World Bank, the WHO actually projects that 10% of Ghana's population has one form of mental health disorder or the other. That's the projection. So if you look at this 10%, what does it simply mean? It means that with a population of 30.8 million, you have about over 3 million Ghanaians suffering from different forms of mental health disorder. Now, if you want to really paint a picture with this 10%, with this 3 million population that I'm talking about, it's more or less like filling the Accra Sports Stadium, which is about 40,000. That's the capacity of Accra Sports Stadium. That's about 77 times of the Accra Sports Stadium. If it is filled to its full capacity, that will be the total number of Ghanaians suffering from different forms of mental health. So it's a very dire situation.
Now, break it down further for us, because we understand that 10% of Ghana's population has one form of mental disorder or the other. We also know that there's a breakdown where about 41% of the people are suffering from psychological disorders. So give us the details as it's contained in that document.
Right. So this 41% that you just talked about is a subset of the 10% that we spoke about earlier. So this 41% of Ghanaians have psychological stress. And this is very, categorical. I say psychological stress. So it's a subset of the 10% population that we're speaking about. And this psychological stress that we're talking about can be mild, moderate, or severe. That's according to the WHO. So if you look at this 41% we're talking about, it's not of the population. So you can have this number being less than the 3 million population that we spoke about suffering from different forms of mental health disorder. So this is a subset of the 10% that we spoke about earlier.
Again, you alluded to this earlier, 16,000 persons with severe mental illness. But in the World Health Organization document, they pointed the fact that we have less psychiatrists to patient ratio, and that's why this is accounting for that.
Exactly. So on your screens now is a survey done by the Ghana Health Service. And the survey points out that there are about 16,000 persons with severe mental health illness. And these people are actually on the streets. So you can see on the streets of Accra, Kumasi, and other places that we've spoken about. But if you look at what you were also saying, the mental health care delivery facilities we have as a country. So if you look at psychiatric hospitals as a country, we have just about 3 psychiatric hospitals. We have 4 regional hospitals supporting this psychiatric hospital. There are also teaching hospitals supporting in the fight against mental health illness. There are also district hospitals. So 4 categories: psychiatric hospitals, regional hospitals, teaching hospitals, and then district hospitals. Grace.
Okay. Now, with a 16,000, what is the makeup?
So the 16,000 are actually those on the streets, and mental health illness, as we know, would definitely come with a certain cost to the state. So if you project this, it's about 7% of the country's GDP that we spend as a country to battle this mental health. It's about 5.5 billion, US dollars, and that's how much we lose as a country as a result of mental health illness. So look at the Ghana Health Service on their websites right now. They've actually indicated that every year we spend close to about 1.4% of the health ministry's budget on mental health alone. That's about 160 million Ghana cedis we're talking about every year that we spend on mental health illnesses. So finally, probably we can also talk about the workforce who are actually working in this mental health, institutions. So if you look at the number of psychiatrists we have as a country is 39. So if you look at 3 million population suffering from different forms of mental health illnesses, and you have just 39 psychiatrists, that should tell you how bad the situation is. Psychologists, 244, that's a bit more than the number of psychiatrists. We also have mental health social workers being about 362,000. Mental health illnesses, nurses are actually the biggest number we see. There was about 2,463,000, and occupational therapists being just 6 of the workforce.
All right, Kofi, I'm grateful for the breakdown you've given us. Now, for more on this, we've been joined on Zoom by Humphrey Kofi, who is into the field of psychology and psychiatry, so we can have more on this. Now, Humphrey, thank you for your time. What is that counting for what we are seeing? 41% of Ghanaians are having psychological disorder, according to data available.
Yes, thank you very much for this opportunity. Indeed, the situation could even be dire beyond what the research has revealed. Currently, we are having some mass exodus of psychiatric nurses leaving the country for greener pastures. If you go to the psychiatric hospital, the 3 main psychiatric hospitals, you realize that there are a greater number of these nurses who are leaving. For the psychologists, we don't even have to talk about it, because the numbers, even though from the research look quite higher than the psychiatrists, is still inadequate in relation to the ratio of the population we have. So the situation is even not getting better.
Now, like you alluded to the fact that we have, lesser rate in terms of expert to patient ratio. How do we address this particular challenge? We're losing a lot of our experts to foreign countries. How do you address it?
So, for instance, you ask yourself, what is the motivation for these people who are leaving? What exactly is motivating them to go? And the bottom line is about their salaries, it's about how they are being catered for, it's about how the risk involved in the area of health, it is also being managed. Because if you are dealing with people with mental health disorders and you are in a psychiatric facility, you stand some risk of being, some higher risk than other conditions that you'll be taking care of. So how is this risk being managed, and what is it that somebody can benefit from should there be any situation where the person is hurt by somebody who is under such psychological distress? So if there is no motivation, then the risk is higher. And if the salaries are not better, then the risk of people leaving for greener pastures where they are very much welcome is also going to be higher.
But again, we are made to understand that we are spending $5.5 billion annually on mental health issues. Do we know where exactly these monies are spent on?
Well, so definitely it will be on salaries, it will be on monies given to the facilities to run. Already this money that we are talking about looks big, but it's quite inadequate, because the psychiatric hospitals are already talking about lack of medication, which is a perennial problem and has never been solved ever since I got into this area of mental health. Medication has always been a problem. I don't know when we can find a solution. Again, feeding of patients is also an issue. Accra Psychiatric Hospital has already complained. Not only them, but even Ankafo has also complained. So we are not addressing the issues headlong. We are always finding a knee-jerk reaction to solving some of these problems, and it's not helping us in any way. So the issue will continue to linger on until we have a holistic approach, ensure that there are enough psychologists. And mental health delivery and provision is a holistic thing that requires psychologists, occupational therapists, mental health nurses, psychiatrists, a whole lot of people, so that there will be a one-stop support for anybody who is in psychological distress or suffering from any mental health condition.
Now, the report talks about the fact that a lot of these experts that we do have are located in the urban areas more. So it means that we need more people in the rural areas. But we again are short of numbers. You are talking about proactive or holistic solution to the challenge. What will be your proposal, your holistic proposal to solving the challenge of mental health?
So, for instance, if you you have also alluded to all the psychiatric hospitals. All the psychiatric hospitals are in the southern part of Ghana. Talk about Pantine, talk about Accra Psychiatric Hospital, talk about Ankafo. In the middle belt, in the Ashanti region and Brown-Ahafo, and also in the northern region, there are no psychiatric hospitals. Much as we are talking about community care and emphasizing on community support rather than institutionalization, it is still important that we have some of these psychiatric hospitals where at least there will be some short stay for people who are in some of these situations, so that at least they are monitored and they are taken care of. So it's not like keeping people in the psychiatric hospital, though we are trying to decongest, but to ensure that people have access to mental health care, at least to the closest minimum distance that they can run. So we will equally need a psychiatric hospital in the Ashanti or Brown-Ahafo that will serve Ashanti and Brown-Ahafo. And then we need also one in the northern region to serve the population over there. Because when the situation is dire, they are moved all the way from the north, from the Ashanti, Brown-Ahafo, to the southern belt, which is Accra, Pantine, and then Ankafo. These things have to be resolved. Also, we need to ensure that at least every CHIP compound, which is the barest level of health support, has mental health services. At least the primary mental health services is available for people who can access it at their closed door rather than traveling. And when the situation gets, dire, that will require day traveling. That's okay. But at least to the barest minimum of their residents, there should be some support in terms of mental health services.
Thank you, Humphrey Kofi, for making time to join us here on NewsDesk. Now,